right now on WPTV NewsChannel 5.
February is Heart Health Awareness Month, and here to get to the heart of the matter is Dr. James Gardner, a cardiologist on staff at Palm Beach Gardens Medical Center. Thank you so much for kind of freeing up your schedule to chat with us a little bit here. Let's start from the beginning. We really are in the midst of two of the most stressful years that a lot of us have endured during this pandemic. So heart disease, heart health, so important. It can be a silent killer. Take us through some of those warning signs that people really need to be watching out for.
Yeah, so heart disease is definitely prevalent, even this day and age with COVID, with everything. It's still the leading cause of death, unfortunately, in the United States, and it's very prevalent. So the symptoms that you can have can be very subtle at times, but can also be very overt. A lot of people experience like chest pain when they walk, exert themselves, or sometimes people can feel discomfort. Even they say is like, heartburn, as they would describe it, arm pain, pain up into the jaw. It's usually with exertion, but things can be silent as well, where they're just short of breath, they're not feeling themselves, their exercise capacity is decreasing. So it can be a variety of symptoms, and early recognition is the key.
One of those things you shouldn't write off. We often hear about diet, exercise, but explain why it is so critical to mitigate the risk factors there.
Right. So the thing about heart disease is that it's completely, in a sense, a lot of it's under your control and preventable. So you really want to be able to try to reduce your risk, and we call that risk reduction. That's diet, exercise. You can reduce your risk of heart disease by 50% if you exercise 5 days a week, 30 minutes a day, so 150 minutes a week. So there's a lot of things you can do to really decrease your risk, with diet and exercise, and listening to your doctor, of course.
And we're seeing some of this video here, and these are older adults. Exercise, go at your own pace. I mean, you don't have to come out of the gym dripping sweat here, just getting in the minimal requirements.
Right, like if you can do some moderate exercise, that's where you get the reduction. It doesn't have to be heavy exercise.
Okay.
If you're at the gym, go at your own pace. If you feel uncomfortable, you can always, see your doctor to make sure that you're healthy enough for an exercise program. And, go there and see how you feel. And if you have some concerns, you can always, back down and discuss with us.
From the local perspective, are you all treating more patients for heart disease these days?
Yes. Over the past, if you look at the statistics over the past 10 years, heart disease has increased, more than 19%. So, it's still, again, the #1 killer, compared to, everything else out there. So we are treating more and more, and, we see that in the community and the need for that in the community.
Really quickly, you guys just reached a pretty significant milestone. 19, and correct me if I'm wrong, 19,000 open heart surgeries, and this is at Palm Beach Gardens Medical Center. Right.
So there's been like a a big established program at Palm Beach Gardens, and it's been there for almost 35 years, and there have been 19,000 open heart surgeries, which everybody plays a part and a role in helping those people get better, and it has been a important.
I know
milestone.
You're a part of that team. That's a lot of coffee.
Yeah, a lot of coffee, a lot of long days, a lot of long nights. So.
Dr. Gardner, thank you so much for your time, kind of spotlighting Heart Health Awareness Month. We
No worries,
appreciate
thank
it.
you.